Hello, future nurses. I am Nurse Jasmine. You may have seen me from Question of the Day and some TikToks here and there. But today is my first question drill, so be nice. We're going to do this together. We're going to go over the questions and then we'll discuss the rationales. A little bit about me. I'm a tele-step-down nurse in Albuquerque. That's where I first started, and now I'm a pre-op nurse, and I'm originally from New Mexico. I also want to give a shout out to Nurse Rebecca because today was also her first live. Let's make her feel welcome to our social media team. And I'm so excited to be here with you today. Let's get ready to learn about effective teaching. We have Nurse Samantha here moderating for us, so feel free to ask any questions and we'll be dropping the answers in the chat, and you can drop your answers in the chat and we can get started. All right. Let's see. All right. Slide. Question 1. The nurse has taught a client with diabetes mellitus who has a new prescription for insulin. Which of the following statements by the client would indicate a correct understanding of the teaching? Option 1, I should immediately remove the needle after injecting the insulin. Option 2, I will shake the vial of insulin before withdrawing the medication. Option 3, the deltoid muscle is the best site to self-administer insulin. And option 4, the needle should be inserted at a 90-degree angle. Alrighty, so this is a new patient or new client with a new prescription for insulin. So we're going to be teaching them from the start how to give the medication. We also want to observe how they're doing it so we can know that they're doing it correctly. Alrighty, so 30 seconds. Drop your answers on the chat. Let's see. What are we answering? Alrighty, so the correct answer is going to be option 4. The needle should be inserted at a 90-degree angle. This is incorrect. This is correct. Sorry, this is a correct teaching of the... Let's start over. So the correct answer is option 4. A 45 to 90-degree angle is the appropriate angle that we want to use for sub-Q injections. Option 1 is incorrect because we want to teach our clients to leave the needle in at least for 5 seconds after administering the injection. That way all the insulin goes in the sub-Q tissue. And then you can remove the needle. Option 2, shaking the insulin vial will cause bubbles, and that's not something we want to do. We want to minimize the bubbles. So if we have something like NPH, the intermediate acting insulin, those are typically cloudy. What you want to do is roll it in between the palms to mix. You don't want to shake it. And then option 3, insulin injections are always subcutaneous. The deltoid muscle is more for intramuscular injections. Great job, everybody. Alrighty, so question 2. It says, the nurse is teaching a client with osteoporosis who is receiving alendronate. Which of the following information should the nurse include? Option 1, ensure you take the medication with food. Option 2, lie down for 30 minutes after taking alendronate. Option 3, drink an 8-ounce glass of water with the medication. And option 4, take your other medications with alendronate. All right, great job answering those other questions. Let me know what you think for this one. What do you know about alendronate? What do you know about osteoporosis? That's where you can start seeing which answer is going to be your best option. All right, so our correct answer is going to be option 3. What do we know about osteoporosis? It's a musculoskeletal disorder that happens when the rate of the bone resorption or the bone breakdown exceeds the bone formation. So you're having more bone breakdown than bone formation, and this is where you have increased risk for fractures. So medication to treat this is the alendronate, which is a biphosphonate, and it works by inhibiting the osteoclasts, which are the cells that actually cause the bone breakdown. And this allows the bone to continue building or quickly. And option 3 is going to be our correct answer. We want to administer biphosphonates with a full glass of water, 8 ounces or 240 milliliters, if you want to be exact. And we want to remain upright for 30 to 60 minutes after taking the medication to promote the complete passage of the medication into the stomach. And this also helps reduce the risk of reflux into the esophagus, which is a complication of alendronate. Option 1 is incorrect because it doesn't have to be taken with food. That would actually lower the absorption of the medication. Option 2, lying down would increase the acid reflux, which is why we teach to stay seated upright or maintain upright 30 minutes after taking the medication. And then alendronate should be taken independently from other medications. Like I said, if you take it with the other medications or with food, it would lower the absorption of the medication. All right, guys, great job. We're answering. Good job, y'all. All right, next question. The nurse is teaching a client with gout about low-purine foods. Which of the following foods should the nurse include? Select all the apply. We have H cheese, canned tuna, smoked turkey, yogurt, and avocado. Let me know what you guys think. What do we know about low-purine foods? What do we know about gout? What do they cause? All right, I'm seeing a bunch of 4s, 5s. Great job, everybody. Don't forget to check our live schedule at uworldnursing.com. We're going live a couple of times a week. And the best way to keep track with our lives is to go to uworldnursing.com or to follow our socials. All right, so the correct answers are going to be yogurt and avocado. So gout is an inflammatory condition caused by ineffective metabolism of purines, which is why we want to eat low purine foods. So the purines will lead to the accumulation of uric acid in the blood, and as the uric acid levels increase, crystals will form in that synovial fluid of joints, resulting in warmth, redness, and swelling of the joints. This could be severely painful. The client could have a fever, and eventually that tophi formation, they're like little, what would we call it? Like a formation around the joints. You've seen it maybe around hands, where the hands look larger than normally up here. So clients with gout should follow a low purine diet to lower the accumulation of the uric acid in the blood, like yogurt, avocados. Other examples include low-fat dairy, like milk, cottage cheese, yogurt, like I just said, nuts, legumes, fresh fruits and vegetables. And we want to avoid foods high in purine, including smoked meats, cheese, and fish like canned tuna and sardines. Great job, everybody. All right. Next question. The nurse is providing discharge teaching for a client with benign prostatic hyperplasia. Which of the following statements by the client would require follow-up? Option 1, voiding every 2 to 3 hours promotes bladder emptying. Option 2, the condition increases your risk for bladder infections. Option 3, it says decreasing caffeine intake can help alleviate symptoms. And option 4, limiting your daily fluid intake helps prevent incontinence. Alrighty, so I'll give you guys some time to answer this question. I do want to talk a little bit about our link that we always mention. It's called uworldnursing.com. You can see it on the top there. But you can find our live schedule here. You can learn more about our product. We also have samples of our questions. You can sign up for a question of the week. We also have a free 7-day trial that you can see there. And you can see an example of an NCLEX study schedule, which I thought was really neat. All right, let's see. The correct answer is option 4. Very good, guys. So what do we know about BPH? It's an abnormal prostate enlargement that affects male clients over 50. We have the prostate gradually enlarges and compresses the urethra, which leads to voiding difficulties. So we want to encourage our clients to drink about 2 to 3 liters of fluid each day to prevent the bacterial growth that can form in the urine that remains. So remember, we want to keep flushing it. The client needs to drink the water so they can actually urinate. So they can also lead to the buildup of bacteria can lead to urinary tract infections, or UTI, which is a complication of BPH. And I know it doesn't seem that serious, but this can, like if the infection can travel to the kidneys, affect the kidneys, the infection can travel to the blood and cause sepsis. So it's really important to teach our clients what they should be doing and what they should be expecting. Let's see, an example of when the client could restrict the fluids is at bedtime or before they're going out. This would lower the risk for urinary retention, and it promotes rest because the client wouldn't be getting up in the night. And let's talk about the other option. It says option 1 is a correct statement. We want to encourage our clients to void every 2 to 3 hours to promote the bladder emptying. We want to keep flushing that bladder. Option 2 is also a correct statement. It does increase the risk for bladder infection, like we just talked. And then option 3 is also a correct statement that does not need a follow-up. So coffee can be a diuretic, and we want to avoid this in our clients with BPH. Great job, everybody. All right, so we made it to question 5. Let's see. The nurse is teaching a client with polycystic ovarian syndrome. Which of the following statements by the client indicates correct understanding? Option 1, I may experience weight loss. Option 2, oral contraceptive use should be avoided. Option 3, my ability to become pregnant may be affected. Option 4, I have a decreased risk for developing diabetes mellitus. Let me know what you guys think, and like I said, start with what you know about polycystic ovarian syndrome. What are the treatments? What do you do? What do you avoid? Let me know. All right. Has anybody passed their NCLEX yet? Let us know where you're watching from. Let's get this chat popping. All right, so the correct answer is going to be option 3. My ability to become pregnant may be affected. So this indicates that the client is understanding polycystic ovarian syndrome. It's a hormonal disorder characterized by the polycystic ovaries on the ultrasonography and that hyperandrogenism, which is excess androgens, which can be seen like excess hair growth, for example. It also leads to excess testosterone and estrogen levels and abnormally low progesterone level. That's the word that was catching up to me. So clients with PCOS and chronic estrogen excess are often anovulatory, which means they don't ovulate. Let's just go with that. They don't ovulate, which can lead to infertility. Option 1 is incorrect. So obesity is a common clinical manifestation of PCOS. Weight gain is more likely than weight loss. Option 2, hormonal contraceptives are actually part of the treatment for PCOS. It helps reduce some of the clinical manifestations. Option 4, it says clients are actually at an increased risk for diabetes mellitus. Great job, everybody. Let's see. Barunda just passed their NCLEX. Congratulations. That's amazing. I remember taking my NCLEX. When I got out of there, I was like, what was that? I just went to go eat Whataburger, and I went to my room, and I isolated because I was rough. But I passed. I'm here. All right, next question, guys. The nurse is teaching a client who had a radioactive iodine therapy 1 hour ago. Which of the following statements by the client would require follow-up? Option 1, I should avoid contact with my 3-year-old child. I should flush the toilet 2 to 3 times after each use. I will ask my spouse to disinfect our shared bathroom daily, and I will wash my clothing separately from my family's clothing. So let us know what you think the right answer is. What do we know about radioactive iodine therapy? Should the patient be around her family, their family? Should they be using the same restroom? Let me know what you guys think. Shut down at 85. All right, Baruna, you did awesome. All right, let's see. All right, I see your answers. Don't forget to like and share. Let's see. The correct answer is going to be option 3, guys. Let's look at these statements as true or false. Right, option 1, I should avoid contact with my 3-year-old child. This is true. I should flush the toilet 2 to 3 times after each use. This is true. And I will ask my spouse to disinfect our shared bathroom daily. This one needs your attention here because they shouldn't be using the same restroom. And I saw somebody commenting that earlier. So great job, guys. Alrighty, and then option 4 is true. So let's move on. Option 7, question 7. The nurse has taught the spouse of a client with a hepatic encephalopathy who is receiving Lactulose. Which of the following statements by the client's spouse would indicate a correct understanding of the teaching? Option 1, the medication may cause constipation. Option 2, the medication is administered as an injection. The medication will improve my spouse's confusion. And then option 4, the medication will decrease my spouse's liver enzyme levels. What do we know about Lactulose, guys? Do we love it? Do we hate it? What do we know about it? All right, I see a lot of right answers over here. I see Baruna giving us some tips. I like this. I like this community that we're building here. All right, let's see. The right answer is going to be... Oh, I went back on the thing. All right, so the right answer is going to be option 3. So hepatic encephalopathy is a complication of cirrhosis that results of the buildup in ammonia. So with the buildup of ammonia can actually lead to confusion. So one of the reasons we give lactulose is to lower that ammonia and improve the condition. That's how we actually compare if the medication is working. Option 1 is incorrect. Lactulose, it causes diarrhea. Option 2 is incorrect. It is not an injection. It's either oral or rectal. Those are the most common routes. And then option 4 is incorrect. It will decrease serum ammonia, which is our goal, not the actual liver enzymes. All right, guys, we're already question 7 of 8. Let's move to the last one. All right, the nurse is teaching clients at a community health fair about prevention of back pain. Which of the following information should the nurse include? Option 1, it says lift heavy boxes using your arms. Option 2, avoid body movements that twist your spine. Option 3 is pull rather than push when you are moving objects. Option 4, lock your knees when standing for extended periods of time. I'm gonna give you guys a couple minutes. I know I've been flying through these, but you guys are doing awesome. A fun fact about myself, Spanish is my first language, so I can teach you guys a little bit of Spanish through here. Let's focus on the word back pain. In Spanish is dolor de espalda. Again, back pain is dolor de espalda. Maybe you'll have a client in the future that says, mi espalda, and you'll be like, oh, your back. Yeah. And they'll be like, oh, I remember from UWorld Nursing. All right, so the right answer is going to be option 2, avoid body movements that twist your spine. So twisting can actually worsen existing back injury, and it's not part of proper body mechanics. Option 1 is incorrect. We want to use our legs, not our arms, to lift. Option 3 is incorrect. We want to push rather than pull. And then option 4 is incorrect. We don't want to lock our knees for an extended period of time, so we want to keep a slight bend. All right, we flew through that, you guys. Way to go. How many did you guys get correctly? And that was it. Thank you guys for watching. And as always, don't forget to like, share, subscribe. And I want to leave you guys with this message today. You have what it takes to be a safe and compassionate nurse, and we are here to support you. We want to build this community. We got Nurse Ancoli, Nurse Samantha, Nurse Rebecca, myself, Nurse Jackie. We have a bunch of people in this team that want to be the best that we can for you guys. Thank you.